But we're not intending on having issues. It just, with as many issues as came in the last 3 or 4 days, you never know. So.
I second that motion.
Any discussions? So all those in favor of meeting for a special meeting to approve the audit at 5:30 on Tuesday the 31st, say aye.
Aye.
All those opposed, the same. Okay, so it's been moved and seconded and approved, and we'll have it at 5:30 on.
I think he was going to send the gentleman who was on there. You normally meet 5:30, correct?
That's on.
And he could do it, but Sean couldn't. So 5:30, and then we can email the state that night.
Yeah.
30.
Daniel, yeah.
Daniel, thank you.
I didn't even think about myself. That's my worst day of the month.
So is that like, we don't really have any choice, I don't think, as far as it being on Tuesday. We might be able to wiggle a little bit from Daniel at 5:30, but I said 5:30 in that meeting.
Right.
Can we manage it?
With me.
So I would I think we need a motion for that, probably.
So, Madam Chair, I make a motion that we have a special meeting on Tuesday, March 31st at 5:30 for discussion and approval of the 2024 audit report and other meetings and other issues that shall come before the committee. And the next.
But we're not intending on having issues. It just, with as many issues as came in the last 3 or 4 days, you never know. So.
I second that motion.
Any discussions? So all those in favor of meeting for a special meeting to approve the audit at 5:30 on Tuesday the 31st, say aye.
Aye.
All those opposed, the same. Okay, so it's been moved and seconded and approved, and we'll have it at 5:30 on Tuesday. Thank you. Okay. You're done, right, Carrie?
I am done.
Okay, so now we're up to you, Pat.
Yep. When do we want to?
Go ahead. Ted wants to take a break.
Maybe we take a 5-minute break.
Surely. Absolutely.
It's been kind of
Sorry, guys.
I knew what Terry was talking for, so if you.
They're going to.
Yeah.
Oh, we'll be back. I just got to. Like memorize.
Okay, but are we ready to come back into?
All set.
Yep.
Oh, they're done.
Because I'm a manager instead of a whatever the other name is.
I did that a lot when we were doing
Directors.
the,
There you go.
Do you, Gary? Just saying.
Okay, let's get going. So if we could have everybody's attention, I think that it's time for Pat to give her update, the CEO update.
Oh, wait. Hold on, sorry. I'm not good at this part.
There you go.
Well, I need to share my email.
I don't know. They can see my words. Hear that call.
Yeah.
You got a presentation.
I don't have quite as many numbers.
Right.
Mm-mm. There we go.
There.
Wow, look at that.
Now I got it.
Okay. So, for the CEO report, I usually keep it simple with very few slides, but feel free to ask me questions during the presentation. So, first, go ahead. So the items are basically these 4 items. I want to talk about the warm welcome, my observations and challenges that I've seen also, but the opportunities and the stabilization plan that we're putting together. Okay. So besides the warm welcome, people were still waiting for me here Wednesday when I got in an hour and a half later due to a problem in Denver's airport. So that was very kind, very nice. And people all were here, so that was pretty cool. So I come into a facility, and I often go into different facilities, and I want to tell you about this one. Very nice, it's clean, it's an updated hospital with mostly private rooms. It's a real gem that a lot of hospitals don't have. My most frequent engagement was at John C. Fremont Hospital, our healthcare district in Mariposa, built in 1949, 1950. 4 patients on the acute side sharing 1 bathroom. And they still have to build a new hospital by 2030 for seismic conditions, but that's that was what we were operating in. So when coming here, I wasn't sure. And it's nice and it's clean, and I've been telling the EVS staff that I meet what a great job they do. I've not met everyone, but the people that I have met overwhelmingly are personable, engaged staff, in addition to, when I say providers, meaning medical staff as well.
This place is full of love. You can tell the people that like to be with old people because they really take care of you good and are very kind.
Twice a day, every day, the activities people have an organized activity that's always interesting.
Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint. Really pleasant to live here. It's a good place to be.
But the people that I have met overwhelmingly are personable, engaged staff, in addition to, when I say providers, meaning medical staff as well. And overall, people are proud to work here. And I don't say this to everyone. To the team that's in this room and then the other managers that are here, I really see a culture and a committed leadership open to learning and change, and open to discussions and banter and pushback. But also when we had the day's cash on hand conversation, it was an alert, but there wasn't a panic, and I feel a real nice feeling of resolve to improve, and we will. I've been blown away by your radiology, not just staff, but the equipment too. Keisha and I met the other day, and I had listened to her have a presentation at a meeting and was talking about all the cardiac studies she wants to do, and I'm thinking, she can do that. And then when we met yesterday and she told me you have a 128 slice CT scanner, what that means is you have a real state-of-the-art CT scanner. And I've said to folks that I've worked in and managed cardiac cath labs with diagnostic and interventional catheterization and even TAVR. And we didn't have 128 slices. So this is something we're going to talk about, a marketing plan and what we're going to be doing about this. But Tomo, for mammography, that's awesome, because I said, okay, you have digital. And she's like, we have Tomo. And that is something that allows the radiologists to really see some real clean images for women. And we've got to get that word out there as well. So terrific. Meeting with you. You took me, Carrie, that night down to the therapy area. Again, a very nice space, good equipment, enthusiastic therapists. And what I really like is it's all internal staff, and they're covering the 3 service lines very nicely. The long-term care facility, I walked through several times, and I'm always looking, and clean space, nice rooms, but nice program. Staff were not sitting at the nurses station. They were actively out engaged with the residents, and has been nicely supporting our residents. Home health, I'm still getting my arms around, but the leadership in home health and the clinics, where are you? Is very much seeking to expand our footprint, both within and potentially outside our county. So I still need to get over there and visit the clinics, and I will, but that is our economic engine, the clinics, of primary care base, to be then feeding our ancillaries. So there are my observations out of the gate. Very pleasantly surprised, and you have a very nice team. And then we just need to take the work that has been done with Kathy and the team to the next level. Okay. Okay. There you go. Challenges. Cash availability, we talked about it a little bit earlier. Contract labor, we talked about a little bit earlier. It's not just long-term care, and we're making strides, but it's some other pockets that you even talked about at potential on our end. How do we avoid that? Because sometimes travelers can cost 3 times more than our normal staff. And then you have unfamiliarity with the organization as well. We have some very good travelers. I'm not throwing them bust. Patient resident volumes. I want these beds full, and we can. So you went from 21 acute / swing beds to 12. But we might have the opportunity to potentially add 2 more, because you have 2 rooms with 4 head walls, or 2 head walls, 2 head walls, right? And we'll talk about that, but I want to get the 12 moving, engaging, going. And then we have the volumes in a long-term care that we have an opportunity for too, with some beds open. Just to be frank, the district challenge, the district dissolution discussions have been unsettling, and kind of as a gut punch while you're trying to stabilize and grow. But at the same time, I appreciate the meeting we had with the managers that same day that the announcement came out, not the announcement, the meeting, because I think it was good to have the conversation. We were good to have you here talk and show it, but also if we had canceled the meeting, I think that would have been a very bad message. And it was, no, we're always going to be open. We're always going to discuss the truth. We're always going to discuss what's happening. Just live transparency. Okay. Payer mix, the payer mix, I'm getting my arms around. So there is a significant Medicaid population. But we also are not quite sure of our payer contracts, our non-Medicare and non-Medicaid contracts and where they stand. Sometimes when I went into one hospital, they hadn't been negotiated since 1995 and it was 2022. And some other hospital I went in, it was all up to date. So we're just not sure. So your Aetna's, your Blue Cross, and all those other kinds of things. They are the payers who make up for the losses on Medicare and Medicaid. So we need to get our arms around them and see how we can increase those service lines in business. But we first got to know what the heck's going on in those contracts. Other challenges, we have pockets of recruiting scarce human resources. And so we're going to talk about that and see what's happened. And climbing expenses, when I say climbing expenses, it's not just that maybe some areas are mismanaging it, but we're getting increased requests for purchase services or drugs. They're increasing their prices to us. And so is our revenue climbing to cover those prices or not? So these are our challenges. This is not uncommon in today, although the district dissolution is unique. Can't say I've dealt with that before, but we will prevail. And there was another item we were going to bring up in here that I'm blanking on now.
I think you touched on, we were talking about the retention.
The ramification and retention that district dissolution discussions may impact. So if people are concerned and we're not able to bring this to resolution, I don't want people to seek employment elsewhere. That's what I just wanted to discuss as a challenge as well. Okay. What are you going to do, Pat? Okay. So one of the things we've been talking to our leadership about, but both at the senior leadership level, but also we had a discussion at the managers meeting, is there's three main categories that I focus on when stabilizing an organization. And it's definitely the revenue cycle is one of them, revenue maximization, and I'll talk about that, and expense management. So I'm always willing to tweak, change, but these are the categories that have been successful. When I went to John C. Fremont, they really probably were in the 11 or 12 day cash on hand. When I first arrived, at one point we did dip to single digits. And when I did leave, we were up to 120 days cash on hand. And then we had an IRS settlement we were working on, so even higher. So again, my goal was 60, 90. But when I talk to our staff, just like in baseball, there's no single grand slam that you're going to get every game to win. And there's no single line item that we can go to that says, oh, there's 50 million. We just fix that. It's singles, bunts, doubles, and it's trying to just chip away. And so let's talk revenue cycle first. We talked a little bit about it already, and we need whatever service we outsource, we have to manage. And also we have to hold ourselves accountable. And what we're trying to figure out too is, the world, before we submit the claim or the bill to our billing company to send, we have work to do on our end. Are we registering properly captured? So we want to see the access piece of it, and then also our documentation, and then how quickly, and make sure we have charge capture, make sure we have the charges. And then we say to our billing and collection company, what's going on? What are the denials? What are the issues? And then, as I said, so this is a world in and of itself that we need to hold accountable and be on top of, like a heat-seeking missile. So the jury's out on how well they're performing. But we'll talk more later, but this is a significant area of focus. The other thing I mentioned to the managers is oftentimes when you have people come in and you're losing money or you have troubles, they think the consulting companies think you just have to cut your way through expense. And that's not my philosophy, and it's not been my experience, and it's not been my approach. So revenue is there. And what does that mean? I don't know the last time we increased our charges. It's just that we got to find out. We need to find out the payer contracts as to whether we can get a percentage of charges. We need to grow the service lines that are our core services and are profitable. We had a neurosurgeon come in the other day and met with our medical staff. Wonderful, great. It came from Monument, and Mark, the administrator for outpatient clinic or outpatient networking, I think he came too. So the neurosurgeon sat where you are and talked to the medical staff, and he said, I'm new, I'm going to do all these surgeries. Here's how you get a hold of me. Here's my philosophy and what have you. So then we said, great, but we want our patients back. So if you treat them and you do surgery on them and they're not quite ready to go home, we have this great swing bed program, and we'll explain to you it's actually inpatient rehab. So we want you to send them back to us versus, another facility near where you're at. Let the patient recover closer to home with family and friends visiting. He said, oh, I didn't know. And so we're going to embark on how we make sure this program is firing on all thrusters, make sure we're able to have a central referral line, someone working the referral process, and working the registration, the insurance verification, and you name it. But we need to educate our community too. And I'm talking to Charlotte about, I think you're on, how do we make sure our community knows that if you go to that neurosurgeon and he says, oh, I need you to get a CT. Oh, thank you, doctor, for the script. I'll get it back in my hometown rather than Rapid City. If before patients leave our ED, because we do transfer out, that's what you do in a critical access hospital if you don't have it, and they're not in distress. Mrs. Miller, if you get your hip pinned, here's our brochure. Here's how you can come back. Give this to your social worker, case manager there. And then we're going to have our case manager and social worker call there and say, we know Mrs. Miller's there. We want her back. So how do we keep this going? And I'm going to have a meeting set up already with Mark to have this conversation and just get this going. And so it's increasing business. And then I would say we may apply to the state for 2 additional beds. Just have to tell them the good news is you're not certificate of need state. But we also need to look at productivity.
And so I just want to let people know that there's money involved for all of us. And what we really owe you, the people, whether we're elected officials, whether we own a media company that accepts them, let's face it, advertising dollars, when it used to be advertising dollars that drove local media, those people, I've had a lot of advertisers pull their money from the newsletter journal and I knew they were gonna. Because editorials I wrote, God, when I went after the fair board, I lost advertising right and left over that. I lost advertising over the hospital board thing a few years ago. Every time we write an editorial challenging something in Weston County, we stand the chance to lose dollars. And so now taking in donations really doesn't make it any different.
We may apply to the state for 2 additional beds. Just have to tell them the good news is you're not certificate of need state. But we also need to look at productivity. How many visits are our physicians seeing a day? How many patients are our physical therapists seeing a day? How many exams are our techs doing a day? Do we flex our staff when volume is low? I think in many ways we do. But we're just going to touch that and talk about that. We certainly flex up if our volume increases, hopefully. We need to have that same flexibility. How's overtime? How's double time? The other thing that was interesting on the revenue side, and I really want to try to figure this state out. Are we getting disproportionate share? I have to talk with Paul. I have to talk with somebody else. In California, we have IGT. You have intergovernmental transfer payments too. Are we maximizing them? So what other programs, grants are available to us on the revenue side too? So, and then I met with the manager of pharmacy today, Suzanne, 340B program, and I let her explain it all to you better than me. But it's a way to manage our costs better and to help the community at the same time. She wants to do it, we want to do it as we get closer. So I'm just putting a bug in your ear that we're going to have energy and small committees and a concentrated effort on these line items. And then on these line items, we're going to say what we expect to save or what we expect to increase by and tie it out to dollars and cents as best we can so that we're covering that gap that we now have in over losses, but at the same time, it's going to track cash flow and cash collections very carefully. Expense management is the third bucket. We just talked a little bit about a productivity system. The other thing we're going to implement together is something called position control. It sounds ominous, but it's not. So when a person leaves, like your nurse that's leaving, before we automatically fill that role, we're going to have a form and questions answered that come to the senior management team. And we would say, Trisso, gee, talk to us. How's the volume over there? It's an RN leaving. Is this a straight RN? Can it be filled with an LVN? That's less costly, but as very confident. Can it be a med tech? Do we need to fill? So when I was at Johnson Fremont, and I was there for 15 months, but we didn't fill 55 positions. And so through attrition, I'm not suggesting that's the goal here, or that's what we're targeting here. But when you are able to reduce your staffing expenses through attrition, that's the way to do it. And and then it also gives opportunity for others to step into roles that we can grow them in. That's not hampered down by licensure. And so it's a thoughtful process that before everybody just runs to fill what they've had, we talk volume, we talk productivity, and we talk skill set, and we talk need. Because in one department, a nurse may be underutilized. Could we move that person over? I know in the ED and the acute side, you share staff. Sometimes in another place, the CNA is shared to long-term care. I'm not saying that will be the case here, but let's talk, okay? So get ready. This is good. This is energy. It's doable, and we're gonna prove, we're gonna tweak, we're gonna add, and we may add some positions too in some areas because I have highly skilled folks doing insurance authorization when I wanted her doing CT exams. Anyway, so they're the kinds of conversations we're going to have, and that's what we're starting. And we'll bring the plan back to you as an FYI, but we're probably going to begin implementing things and move it forward. But we're going to keep you updated. Okay. Any questions? Thoughts?
Yeah, don't wait on us.
No, we are not.
It sounds like she's hit the ground running.
Yeah.
Well, these folks have, so I'm looking forward to working with them and stabilizing and moving it forward.
I have one question. So did you work in Chico at a hospital there?
I did. Are you from Chico?
No, Southern Chico. I'm from Arkansas, really. But I have, my aunt lived there for several years.
Okay.
So I visited there. She took care of my grandmother the last 8 years of her life there. And my cousin remained there. So been there lots of times.
It has grown.
It has grown tremendously.
Amazing. In the early 90s, I was there to open an acute rehabilitation hospital. I'm trying to remember the name of the street. You would have known it. It wasn't with Enloe. It was farther down. And I was there about 3 years.
Can't remember. It was in California.
Oh.
Okay, so any
Started after the election.
any questions for Pat? More questions or any thoughts or what? Okay. Okay, well, where are we on the agenda? I just thank you, Pat, for hitting the ground running.
Yep. We're cooking.
Dottie, do you have a?
I do. Just a few things. I assumed that our dinner tonight was made by the new chef. And so anyway, he cooked our lunch for our foundation board meeting too, and it was very, very good. And so I've heard some really good feedback, and I've seen some good advertising on Facebook as far as anyway, kudos to the chef. And so the other things are Kim and Keisha were also at our meeting, and Kim gave us the financial updates and stuff of what's going on. And one thing Keisha talked to us about was, the foundation board is usually for like giving scholarships and stuff, but if we ever did have extra money, Mark, my husband, told Keisha, if there's ever any department that needs some smaller equipment, to help with that too, because she what was the table you said in the emergency room?
$18,000 for a new gurney. Is that correct?
Ooh,
Was it gold? Something like that, because it had the scale on it. Wasn't that what you had?
Tonalda had a quotable.
I don't remember.
I think so, but the foundation gave $20,000 in 2024, I want to say, and we were able to buy a bunch of equipment. And then, of course, they assisted with the CT install.
Yeah, there's some items in PT that I talked to Mike about. Small items.
Yeah, and so
Calculator. Yeah.
yeah, other than just giving
Yeah.
the scholarships,
Yeah,
if
absolutely.
any of the departments had any smaller equipment
Yep.
requests, we didn't quite realize it was going to be 18,000 when she brought up the table, but she said it has a bad wheel on it, and so sometimes
ER2.
it's really tough to get it wheeled.
Okay.
But
We'll look at
if
that.
they don't tell you that, you don't know.
Well, at some point, we're going to we talked as a team about restarting the safety call. That's every morning is a safety call for managers and directors to call in, and that's where you can really encourage staff to tell the managers and directors about broken equipment. We have a list of things that we want the staff to report: falls, medication errors, doors stuck. And so that we'll put this process back in probably soon, and it'll bubble up so we'll know it better in real time.
Good. Okay, and so then Mark gave some financial reports, and also she wasn't at the meeting, but Holly Borton, and I don't know if you guys know who she is. She's at the
Farm Bureau.
Farm
Bureau.
Bureau. Anyway, she's going to be joining the foundation board. Joanna Akers contacted her and asked her if she'd be interested in being on the board, and she accepted, and so her name was submitted and it was also accepted. So she will be joining. And I think that's it.
Me. Lottie?
Oh, thank you.
Mary, I have an apology. I skipped you on the agenda. Did Tim or Polly cover everything on the?
I just want to say I appreciate the safety thing because of your relative.
We have skipped quality somewhere. Where is? And I'm like, oh, there's Mary right there. Anyway, so I'm sorry that I missed you. Okay. Okay, so now we need to talk about the canvas board. So basically, Denise, do you just want to tell us what you know, or should I?
Sure, I can. So, according to the statutes in March, we have to have the board has to appoint a canvas board, which consists of the board secretary, unless she's running, which she's not this year. So the board secretary, and then 2 community members, which I have approached a couple community members who have said that they would help us, which is Gilbert Nelson and Norma Shelton. And they said that they would. And I talked with Mary earlier, and we have set up a date of May 6th, which is the day after the election, to do the canvas board, which, for those that don't know, that just makes official the election, make sure all the counts. And so if there's anything that is off, or if there's a tie or anything, the canvas board is the one that makes everything officials. Okay. And so at 10 a.m. on May 6th, we will meet.
So I think we need a motion.
Yes, we need a motion. That's what we have.
Somebody is willing to move that the CAMC board will include Gilbert Nelson and Norma Shelton, and that it will be May 6th at 10 a.m. That would be appreciated.
Madam Chair, I make a motion that we appoint a canvas board of Gilbert Nelson, Norma Shelton, and Mary Rankin to meet May 6th at 10 a.m. to certify the election.
Do we have a second?
Second.
James, again, 1 or 2? Okay, so it's been moved and seconded. Any discussion? Okay, so
I just want to say thank you in advance.
Kidding. Yes, we were on that last 2 years ago.
Yeah, it's kind of fun.
It's fun. Yep. Okay, so all those in favor of Mary Rankin, Gilbert Nelson, Norma Shelton being on the canvassing board May 6th at 10 a.m. say aye.
Aye.
All those opposed, the same. Okay, we have canvassing board and meeting. Okay, so now we need to talk about the CEO addendum piece. And so if you look at your back page here, Allison, do you want to talk about this, or do you want me to? Or should we have?
It was a little hard for me to hear what you were talking about, the last page of something.
The Kathy's addendum.
Oh, sure. So this board had approved at the prior meeting the hiring of the interim CEO so that Kathy could go on leave. Kathy has generously offered to go on leave with just payment of her benefits, the employee side of her benefits while she's out, not taking any other leave benefits, including paid time off. And so I have captured that in this addendum, just a document. Since she is a contract salary employee, we're just modifying the terms of the contract temporarily while Pat's here with us and while Kathy's on break.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
So Rebecca helped put together, as Kathy had asked in the last meeting, to make sure she's covered for health, dental, and her benefits. And so what Allison helped us put together on is a how she will be paid to cover, those expenses. Cause we'll just draw them out, we'll put them in and then we'll draw them out as covering. And it's tied to her being available if we need her. It's in consideration of that.
Do we hold this off until we get out of executive session? Vote on this?
He wants to talk. So.
Oh, okay.
I misunderstood what you said.
Yeah, I would like to have a discussion before we vote on this.
That's, that'll work. Okay. Okay. So actually, I think we're ready to move into executive session. I think. So, and I think all we need is Paul.
Well, you stay after school. You're all excused and paroled. And wipe those smiles off your face.
Oh no, we will move into executive session in 5 minutes at the most. We already had a break.
Thank you for staying.
Yes.
Thank you for hanging out with us.
Yeah.
You have a good evening.
Yes, I can remember.
How do we?
I see cheesecake.
Should we write those names down, I guess? Should we write those names down?
No, you're lying.
Oh, you're voted for this.
Oh,
That's all.
Why don't we just say, let's credential all of Blue Sky
Oh, and we have to get into our, well, we have to make the motion and then.
I have to tell Denise first, my cell phone is working now.
Okay, good. All right, thanks for letting me know.
Madam Chairman, I make a motion to enter executive session under Wyoming statute 16-4-405 AII to consider the appointment, employment, right to practice, or dismissal of a public officer, professional person, or employee, and 6, to consider or receive any information classified as confidential by law, including attorney-client privileged communications, patient information, quality information, and trade secrets.
Very good. Do we have a second?
I second.
Okay, all those in favor say aye.
Aye.
All those opposed, same. Okay, we are in executive session.
I have to get it so big.
It's all those neurologists.
Neurologist went out.
No, I'm talking about on the screen up there. Usually where that, there we go. Usually the little guy.
Just said it would be. Okay. Anybody wants, so we have some.
So it is 9:06, Mary? And we are back in regular session.
Do we have, any, does somebody want to, move the,
I make a motion that we approve the addendum to Kathy's contract.
do we have a second?
I'll second that.
Okay, any discussion? All those in favor of approving the addendum to Kathy's contract, say aye.
Aye.
All those opposed, same.
Madam,
Then it's passed.
Madam Chair, I make a motion to approve the credentialing for Alicia Bennett, DO Neurology, Quang Dang Wu, MD Neurology, Nishi Ragan, MD Radiology, Kent Newsom, DO Pathology, Kevin Y, MD Neurology, Hiroshin Hakashani, MD Neurology, Jeffrey Wagner, MD Neurology, and Dwayne Charles Franklin, MD Family Medicine.
I second.
Okay, any discussion? Okay, all those in favor of approving all the credentials for all those people that you just listed, say aye.
Aye.
All those opposed, same?
I
Okay.
was gonna have you rename.
I wanted to
reread all those.
restate the motion.
I was going to say the same thing, you know, what was that third time? I just sat there.
You guys,
It is.
it's too late for that now.
Well, while I was discussing, I should have asked Pat, you're sure you're coming back?
Be back here.
I'll be back.
Ben.
Okay, thank you. I
Thank you.
definitely will be back. You know, even though this is a different scenario, I've been through some pretty tough world.
Okay, guys, I sent
Madam
all of
Chair, I
Yes,
make a
ma'am.
motion to adjourn at
9:09. Okay, do we have a second, please?
I'll second that.
Okay,
Get my stats up.
okay, very good. Any discussion? All those in favor of adjourning, say aye.
Aye.
All those opposed, same? Okay. We are adjourned.
So I do want to let you guys know that Eric Boley, when I was talking to him today from the Wyoming Hospital Association, did mention that they do have training available. They have a best in boards training that's free, that any trustee can take. They have a trustee education series, and they are having a, symposium forum, something in, Sheridan in May. And I asked Denise to get that information out to the boards, to all the members. So if you are all interested in any of these things, they are available to you.
And the other thing is I sent everybody, a copy of what Allison was talking about. I just sent it while she was talking about it.
And I'll get that letter together and out.
And after the work that he's done for us in the last couple of days, I sincerely apologize for my past, request that we consider removing the Wyoming Hospital Association dues from our budget. So I apologize, I was wrong about that. And I'm glad y'all voted.
Yes.
And the other thing is,
That would be the last I pay, when we're managing that.
I don't.
Thank you.
Do you have names? Email address?
Yeah, it's ntodd@westonwi.gov.
Yeah, I do not have.
Ntodd. These are one. That's
Good night, everyone.
PODD.
at.
Good night.
Thank
All right, thank you.
It's on the,
It's on the webpage.
Yep. So, and I will forward these.
We sign in anytime. And my wife.
Sign a check if you want.
No, James.
No, I'm-
Me.
I was taking,
And
call you with. I was taking her money. She won't, she won't need it. She won't need it when she gets the spine. She'll be in
You
jail.
guys are fun, but I'm gonna go now. You're still recording. Good night.
Thank you, Allison.
Still recording? Go.
Yep.
I just come in and get it.
Where's that little door? Oh, there it is.
so